several MPs have asked about the affordability of healthcare. We have a multi-layer system of support to ensure that Singaporeans can afford the appropriate care that they need. Treatment and drugs that are clinically effective and cost-effective are subsidized. Means-tested government subsidies as hospitals, outpatient clinics, CHAS clinics, and nursing homes serve as the baseline support. Larger bills, such as inpatient hospital bills and selected costly outpatient bills like chemotherapy and kidney dialysis, are covered by MediShield Life. Since its launch in late 2015, MediShield Life has provided Singaporeans, and especially the seniors, with better support and assurance. Over 500,000 claims were approved under MediShield Life in 2016, an increase of 47% compared to 2015, the year before. Claims by older Singaporeans aged above 65 increased even more at 73%, from 124,000 to 215,000 claims. This resulted in a 90% jump in the total amount of claims for seniors, from $181 million to $343 million. Mr. Murali Pillay asked about MediShield Life coverage for direct admissions to community hospitals. MediShield Life was designed primarily to provide coverage for large acute hospital bills. As an extension of this coverage, MediShield Life covers community hospital stays for patients transferred from acute hospitals to community hospitals. Nonetheless, we note there could be some groups of patients who are suitable for direct admission to community hospitals without going through acute hospitals and might benefit from MediShield Life coverage. We will study this proposal carefully because it has impact on the premiums as well. After subsidies and MediShield Life, the patients can use his MediSave savings to help cover his share of the healthcare bills. Dr. Lim Wee Kiat asked if the Flexi MediSave limits could be raised. The Flexi MediSave scheme was recently introduced in 2015 to allow older Singaporeans to use up to $200 a year to pay for outpatient medical treatment. So far, the majority of eligible patients have not fully utilized their Flexi MediSave withdrawal limits. It's still early days, but it suggests that the claim limits is generally sufficient. We will review from time to time. Finally, for needy Singaporeans who still have difficulties with healthcare costs after government subsidies, MediShield Life coverage, and MediSave, we have MediFund to help them. Mr. Loh Tia Kiang asked about profit margins for our drugs in our hospitals and public healthcare institutions. I should take this opportunity to clarify that our public healthcare institutions are not for-profit organizations. While the drug prices include a margin, this is to offset overheads and operation costs. Therefore, they are not profit margins. They are just margins to cover part of the operation costs. In fact, last year, we provided a total of $4.3 billion of funding to our public healthcare institutions to support their operations to keep our healthcare costs low. To help patients with their medication costs, our public healthcare institutions, like our SOCs and our polyclinics, provide subsidies of up to 75% for standard drugs, with pioneers receiving a further 50% subsidy. In addition, the Medication Assistance Fund, or MAF, is also available to help patients with selected high-cost, non-standard drugs, if it is deemed necessary. Patients who still face difficulties despite all these subsidies can also apply for MediFund. With government subsidies and the 3 M's, MediShield, MediFund, as well as MediSave, Singaporeans have multiple layers of support for their healthcare needs. The system is constantly evolving, and we will regularly review the adequacy of drug subsidies and the different schemes to ensure that medication remains affordable.